Okay, for pretty much as long as we can remember, high blood pressure meant one thing, right? Taking a pill every single day. Or, let's be real, probably a few of them. But what if? What if that whole routine is about to get a massive, almost sci-fi level upgrade? Let's dive into the science that's making this happen. I mean, just think about it. What if you could manage this chronic condition without that constant reminder pinging on your phone? Without the sound of a pill bottle or that little knot of worry in your stomach when you think, wait, did I take my meds today? Well, that's the future we're talking about. A future where you control your blood pressure with just 2 shots a year. A simple injection once every 6 months. That's it. And look, this isn't some far-off dream. For millions of people, this future is getting closer and closer. It's all thanks to this incredible wave of new therapies that are about to completely change the game for managing hypertension. So let's break down exactly how. All right, part 1, hypertension's hidden crisis. Before we jump into all the cool new stuff, we really have to get a handle on just how big of a problem we're dealing with today. 1 billion. That's a staggering number, right? That's how many people worldwide are living with hypertension. It's often called a silent epidemic, but the real crisis, it's in how we're treating it, or maybe how we're failing to treat it effectively. And, for a whole chunk of those people, the situation is even tougher. They've got something called resistant hypertension. Now, what does that mean? It means even if they're taking 3, 4, sometimes more different types of blood pressure meds, including a diuretic, their numbers still won't come down to a safe level. It's a huge, frustrating challenge for everyone involved. And this chart, wow, this really puts it in perspective. Look at this. In the US, even among the people who are getting treatment, a whopping 65% aren't hitting their target blood pressure. Let that sink in. It tells you pretty clearly that the tools we've been relying on just aren't cutting it for most people. Okay, part 2, the limits of our toolkit. So that begs the question, right? Why? After all these decades of medical advancements, why is it still so hard to get blood pressure under control? Well, let's take a look at the toolkit we've been working with. And to be fair, our toolkit has an impressive history. This timeline shows a ton of innovation. I mean, starting back in the 50s with diuretics, we had these waves of new drug classes popping up. You had beta blockers in the 60s, ACE inhibitors in the 70s, then ARBs in the 90s. A lot of folks are still on those today. For a good long while, we were making some seriously big leaps. But here's the problem with pills today. The reality for so many people is this thing called polypharmacy. It's a fancy word for having to take a whole cocktail of different pills every single day. And that comes with a bunch of issues, right? You got side effects, the financial cost can be a real strain, and honestly, it's just a pain to keep up with. So when we talk about poor adherence, it's not really the patient's fault. It's a system failure. We've got to do better. Okay, part 3, rewriting the rules of treatment. And that's something better? Well, it's finally here. Now we get to the really exciting part, the groundbreaking science that is completely rewriting the rulebook. So let me introduce you to the RAS. That stands for the renin-angiotensin-aldosterone system. You can think of it as your body's master control panel for blood pressure. For decades, our old drugs were kind of like trying to dam a powerful river at a bunch of different spots. But these new therapies, they're totally different. They're finding clever ways to go straight to the source and turn off the tap, targeting this system with a precision we've just never had before. The first approach is incredible. Think of it like hitting a mute button on a specific gene. So instead of trying to block a problematic protein that's already floating around raising your blood pressure, what if you could just tell your body to stop making that protein to begin with? That is the whole idea behind a new drug called zilebesiran. It uses this amazing technology called siRNA, that's small interfering RNA, to basically silence the gene that makes a protein called angiotensinogen. And that's the very first domino in that whole RAS pathway. The difference this makes is just night and day. You go from a daily pill to a shot just twice a year. And does it work? Oh, yeah. The results are incredibly powerful. A big trial, Cardio1, showed it drops systolic blood pressure by over 15 points compared to a placebo. And get this, that effect lasted for the entire 6 months from just one shot. That kind of consistent, long-term control, that's basically the holy grail in hypertension treatment. All right, next up is a different strategy, something we can call a source controller. This one goes after another player in the system, a hormone called aldosterone. Aldosterone is what tells your body to hang on to salt and water, which in turn drives your blood pressure up. So what do these new drugs do? They stop its production right at the source. There's one called Baxdrostat, and in the Brighton trial, they tested it specifically on those patients with resistant hypertension, the really tough cases. The results were fantastic, an 11-point drop in systolic blood pressure, and that's on top of all the other meds they were already on. This is a huge deal, offering real hope for people who thought they were out of options. And it's not just about the RAS pathway. There are new players coming onto the scene that work in totally different ways. Take aprocitentan 10. It just got FDA approval back in March of 2024. It works by blocking a chemical that tightens up your blood vessels. And it turns out it's especially good at controlling those dangerous blood pressure spikes that can happen overnight, which is a major risk factor. The main thing to watch for is a side effect of fluid retention, so it's something doctors have to manage. But let's think even bigger picture. What's the ultimate goal here? Could it be a hypertension vaccine? Seriously, the idea is to literally train your body's own immune system to create antibodies that find and neutralize the very molecules that cause high blood pressure in the first place. And this isn't just a wild theory. We've already had a proof of concept. An early trial for a vaccine called Ang-Cube Site-006 actually worked. It successfully prompted the body to make antibodies against angiotensin II, and it did lower daytime blood pressure. Now, its development was halted because it just wasn't quite as strong as the pills we already have. But it proved the concept. It opened the door and showed us that a vaccine for hypertension is absolutely possible one day. All right, part 4. A new era of control. So when you step back and look at all these different breakthroughs together, it becomes really clear. We are stepping into a brand new era for controlling blood pressure. So let's just recap what we're looking at here. You've got gene silencing, giving you incredible sustained control from just a couple of shots a year. Then you have these new aldosterone blockers, which are like a precision-guided weapon for those really tough resistant cases. And then, looking even further out, you have the potential for vaccines, the ultimate dream of long-term self-regulating control. You know, the researchers who reviewed all these new therapies said it perfectly. They said, this isn't about finding one single magic bullet. It's about building a whole new toolkit, one that's diverse and powerful enough to finally overcome the limits of what we're doing now. And that brings us right back to where we started. Could a twice-a-year shot one day replace your daily blood pressure pill? Well, it looks like the answer to that question is getting closer to yes every single day. The future of medicine is all about making treatments that are not only more effective and precise, but also way simpler for people to live with. And for that 1 billion people out there with hypertension, that future can't get here fast enough.